Crisis help for mental health concerns is available in Waterloo Region, Wellington, and Dufferin counties. A coalition of mental health agencies, service providers, and stakeholders work together through a collaborative network known as Regional Crisis Services. The Regional Crisis System originated out of a need to develop a consistent community approach to responding to crisis issues.
The Ministry of Health was reorganizing the boundaries by which health services were being provided within Ontario, and Waterloo and Wellington were brought together under one umbrella. The main areas of concern were that the police were spending increasing time and resources on addressing mental health concerns in the community, and this was leading to criminalization of mental health. In addition, the emergency departments were experiencing a lot of pressures and increasing wait times for services.
All local hospitals within Waterloo, Wellington, and Dufferin are linked to the Crisis Intervention Services and are available 24/7.
In particular, we're starting to see a lot of shared understanding in how we can work together. There have been protocols developed with police, as well as the most obvious, the emergency mental health service that we're currently developing, which is a partnership between Homewood and Trellis and Guelph General Hospital. With it, we will be constructing a dedicated unit to ensure privacy, safety for patients as well as staff, should they have to wait for a period of time for either a bed or need de-escalation and stabilization.
The crisis system has enhanced the service response to citizens by making it easier to navigate, so that all the professionals involved with someone with a mental illness are that much more knowledgeable about where to direct them and where they can get the appropriate services. We will get a referral from patrol officers, and it'll be our role to coordinate an effort with the mobile crisis team to go out and meet that person to make sure that they are connected with the appropriate services in the community.
Mental health mobile crisis teams are accessed 24/7 through the crisis lines. They can also provide joint services with police and emergency services as needed.
It's great when the mobile crisis team partners up with the police, because we can also go out and provide our expertise, such as giving a mental health assessment and also support to the individual who may be in distress. So when the police do call the mobile crisis team out, we can go out to help with a distressing situation and supporting them with getting connected to community supports. We always go out in pairs for safety reasons and also as a partnership, so we can bounce ideas off each other and so that there is a comfort level with the individual. A time when mobile crisis team would call police would be for safety concerns. We do go out in regular clothes and we do not drive a marked vehicle, so some individuals find that more comforting and supportive.
I think we've come a long way. The police aren't always being necessarily the first call. The main role that the police service plays is being a referral source, and we will refer them to the mobile crisis team or other service agency providers within the community.
Regional Crisis Services is a recovery-oriented mental health and addiction system. In the recovery model, consumers assume more and more responsibility for themselves. For individuals experiencing a mental health crisis, recovery is a process, a journey designed by the individual. A recovery-driven mental health system is a system driven by recovery values and principles.
One of the initiatives that the Regional Crisis Committee addressed early on is the concept of recovery. It means putting individuals and their needs at the center. It means putting individuals in the driver's seat of their services. For us, it has meant an active partnership with the Self-Help Alliance. We have worked together to develop a wellness recovery action plan, which is a way for individuals to think ahead about the kind of services they would like to receive should they have a crisis.
The Self-Help Alliance is a partnership of 4 organizations. These 4 organizations came together so that they could pool their resources and hire staff to work on behalf of their members. The members are people who've experienced mental health issues at some point in their life.
We provide peer support for individuals who come into the different centers, sometimes one-on-one, sometimes during a group session.
I think the peer support role is very important in a crisis situation. Probably the strongest part of peer support is that many of the people have been there, so they can empathize. They know what people feel and what they're experiencing when they are in crisis. They also can be quite familiar with the resources that might be most helpful to an individual.
I believe that peer support should be at every juncture, from implementation to evaluation, sitting on committees, being a part of the system itself. I believe that the crisis system really needs to support those with mental health issues through hope and possibility.
To get into crisis respite, there are certain criteria that need to be met just to make sure that we're meeting the individual's needs while they're staying with us. First of all, they need to be more than 16 years of age. They need to live in Waterloo, Wellington, or Dufferin. They need to have mental health concerns. And with that, it does not necessarily mean that they need to have a mental health diagnosis from a professional. So oftentimes that's depression or anxiety. They need to be street drug free for 7 days and alcohol free for 3 days.
The hope that leads to recovery is the individual's belief that recovery is possible. Recovery is distinguished by its emphasis on the individual's active participation in self-help activities. Much of what is being recovered is a way of being in the company of others. Many consumers report that the most powerful form of connection is helping others who are also living with mental illness. Crisis lines in Wellington, Dufferin, and Waterloo provide streamlined access to appropriate mental health and crisis services 24 hours a day, 7 days a week. Trained crisis line staff and volunteers provide confidential help, linkage to mobile crisis response teams, crisis and risk assessments, and linkages to local emergency services.
The crisis line is the first entry point for people accessing crisis services. It's one number and available 24 hours a day, 7 days a week. So it allows people to first meet a caring, compassionate person who wants to understand their situation. It also is a resource to tell them about other services and options for them. And it just allows them to know that there are some linkages that we can help and assist with. We want to empower the individual to do what's in their best interest, and by doing that we have to offer lots of options, resources, and also just provide that immediate connection so the person can figure out what's best for themselves. We also really encourage people to use crisis plans so they can do that before they go into crisis. The police are able to access the mobile crisis through our service, as well as get some resources and information from us. It allows them to take mental health approaches to situations instead of just being limited to taking legal action. I love everything about my job. I love the moments that I can actually help provide hope and for them to see a future with less pain in it.
In 2001, we were forced to phone the police and have them come to our house to take up my son to the hospital. He'd been at home for about 5 years, not leaving the room and not participating in the community in any way. So our contact with the crisis service at that time was with the police, because there wasn't a mobile crisis outreach team or anything else in the area. When my son needed to be taken to the hospital by the police, I was very impressed by how supportive and kind and concerned that the police were. But I know that wasn't everyone's experience, so I'm happy that there is so much support and education going to the police and work between the police service and the mental health community to support each other, because this isn't really a police problem. Police are needed as part of the mental health system, but this is a health problem and it should be handled as a health issue.
In the past, perhaps there was more stigma associated to it now, but I think we definitely receive much more training.
There was a point in time when individuals appearing in crisis were seen to be less acute than those presenting with heart attacks, difficulty breathing, etc. I think there's a common acceptance now.
Stigma is still a significant part of our culture, our society. Things are changing, I think ever so slowly though.
What's nice is that the crisis line is a safe place to be honest about what they're going through and to get some validation and normalization that this is something many people experience.